treatment. So if you suffer from hot flushes, or you have patients suffer from hot flushes, or have friends and family members suffer from hot flushes, and today's topic is going to be valuable for you, because it's gonna to help you to balance the organs, to help to reduce the hot flush. By that I mean you don't need to see a practitioner, an acupuncturist, then you will be able to help yourself. But I'm not saying that you should just follow this without seeing your acupuncturist. Right? You should still go and get a proper acupuncture treatment or Chinese medicine treatment. But there are something that you can do for yourself. That's acupressure at home. I'm going to show you some point. I'm going to share with you the theory. Why do you have to do those points? So once you know the theory, once you know why those points were effective, it's going to work for hot flushes, then you will keep doing this. And when you see the result, you know why, the reason why it works. I hope that makes sense to you. Right. Let me share. If you're here, please say hi to me. If you're joining in, and thank you for joining in, and please say hi to me. The first thing, the second thing, please give a thumbs up and share this live video, please. Thank you very much. Share on the social media. If you're Facebook, please share. If you're on Instagram, please share it as well. Thank you. Right, I'm here on my Facebook. I'm sharing it right now, and as well as going to my personal account on my Instagram and do a live video. My clinic Instagram is on live, and my clinic Facebook page is online too. So if you watching the replay, and please leave a comment down there. What have you been applying daily to help your hot flush? If you're an acupuncturist, please leave a comment down there and let me know what have you been suggesting your patient to apply on the acupuncture point daily to help hot flush. Because my strategy may not be the same as your strategies, but I want to learn too, and I want to know what has been working for you. All right, let's start. Now we know hot flushes. Most of the time it causes, when in the clinic, when we see most people come to us hot flushes is women, and because they going through premenopause or menopause. Now we know hot flushes is a symptom. Then I'm going to give you some point that's going to help the symptom. Then the next thing is, we know that the menopause is caused by hormone imbalance. I'm going to give you some acupressure point that for hormone imbalance. Then further on, I'm going to give you 3 points that's going to look after the entire organs. Now, because you're not going to an acupuncturist to get treatment. So in general, as an acupuncturist, I will take your pulse and figure out which organs out of balance the most, which organs we need to target at time. So with needle. But for you to do acupressure point at home, you don't know which organs out of balance the most at time, and you don't know which one you need to focus on and target, right? So what happened is, I'm going to show you some points that target all the organs, right? So we are assuming all organs out of balance. That's it. So we target all the organs. So it doesn't matter which organs out of balance the most, you're going to target. Does that make sense? This is a strategy for acupressure point that I'm going to show you. So for those you you don't know the reason why causing hot flashes in your case, you're not going through menopause, but you just get hot flashes, then I would suggest you get the organs one done, as well as get the symptoms acupressure point done. You don't have to do the hormone points. I want to make clear first so you know what you're expecting in the following topic contains. Thank you. Hi everyone. I see that Suzette, Veronica, Eric, Injin, Len Hua. Very nice to meet you guys this morning. So please give me a thumbs up and remember to share this live video. Thank you. I think this is going to help a lot of people if you share it with your friend and family, because just two-thirds of women who are going through menopause experience hot flashes. Right. If you have been following my video in the past, then what happened is, you know, this 3 points. These 3 points are going to help the entire body. This 3 points I introduce to all my patients. I actually can film down this video and show my patient how to locate those points and do it every day. And personally, I do it myself every day. So this 3 points are going to look after the entire organs. So look at that. The first point is large intestine 4. Get your thumb up, and the crease on your thumb, this is the joint here, and match the side over here, the crease over here, match over here, and where your tip of your thumb is. Okay, this is large intestine 4. With large intestine 4, normally you go there and hold it like this, is much easier, and keep pressing and wrapping in there. Or you can search up and down, get the most sensitive one, and rub at base for 1 to 2 minutes. Get the most sensitive point and keep pressing it and rub it for 1 to 2 minutes. All right, this is the first point. And the second point is spleen 6. And how do you do spleen 6? Over here. So about 3 fingers from the crease here the wrist, the crease of the wrist, going down there, and the level over here, in the middle of the point. Get your knuckle and press it in here. You can press it in between the tendons or one or the other side of the tendon, and that's fine. You can search from here, go to there. You can do 3 points on the side, 1 in the tendon, 2 and between the tendon, 3. So those 3 points get one sensitive one. Okay, if you can't find it, go up a little bit or down a little bit to search the sensitive point. When you get the most sensitive point and rub it for 1 to 2 minutes. Again, 1 to 2 minutes. Very simple. This is called spleen 6. Pericardium 6 area. Pericardium 6, not spleen 6. Right. Then the next one is stomach 36. 足三里. Which under the kneecap, you have the depression in the outside of your knee. Okay, you can feel that there's very big tendon under the kneecap in there, in the center of the kneecap underneath. Then in the outside, there's depression, and 4 fingers from the depression go down and go to here, and about 1 finger distance like this, that much from the shin bone. From the shin bone, then search around and get the most sensitive point in here, ask the point. Once you get it, 1 to 2 minutes, rub it. Okay, right. Then there are 3 points now. All these 3 points are very, very powerful. They are for all entire organs balancing. Right. To do it every day, at least once a day. Okay. These are for all the entire organ. But if your hot flushes, you don't know the reasons, then do those 3 points. If your hot flusher is causing by the menopause, do all those 3 points daily. Now, which means no matter what happens, what is the cause of your menopause, those 3 points you must practice it every day. Right. Further on, if your hot flusher is causing by menopause, you're going through menopause, then we know this is hormone issues, hormone imbalance. Now, what should we do now? I'm going to introduce 2 points. They are very powerful for imbalanced hormone. You're going to correct your hormones, get the hormones more balanced through this 2 points. And the first point is spleen 6, which is in your medial side, which is inside of your ankle, above the ankle bone. We call 3 chun. How do you know it's 3 chun? Get your 4 fingers above the ankle bone. Right, you get to here. Of course, that's too much, right? That's actually in here. So about 3 fingers above that, you get to here. So right behind the shin bone, which is in the edges of the bone, just right next to the bone. 4 fingers above that, this is level, and go right behind the shin bone and search up and down, get the most sensitive one, and then press it and rub it for 1 to 2 minutes. Well, your aim is get rid of all the sensitive points, but not in 1 or 2 days, 1 or 2 weeks, or even not in 1 or 2 months. As you're going, you feel that the tenderness spot getting less and less and less, and you are doing the right pressure. Okay. The next one is spleen 9. And spleen 9 is easy. Under the knee, you have so the kneecap, you're going down, and there's a depression right beside the shin bone. Or you come on here, you go to the edges and push it up until you go, your finger drop down to a depression and you can't get any further. And that is the point of spleen 9. And in general, this point is very, very sensitive. And this tenderness spot, give it 1 to 2 minutes of massage, of acupressure, right? Simple. So spleen 9, spleen 6, both of them are very good for hormone, female hormone, right? That's it. Now we're coming to the next one. The next one is for the symptoms. So spleen 6 and spleen 9 are for those who suffer from hot flushes and you know that you're going through menopause, and this is going to help you. Right. What about next? Next is, it doesn't matter what the cause is. It can be imbalanced hormones, it can be any others, we don't know, or you don't know, doesn't matter. This point is going to help the symptoms. And yes, we're going to use heat balance. If you're an acupuncturist, you know what heat balance of balance method acupuncture. Coming from balance method acupuncture, heat balance pattern for meridian, small intestine, heart meridian, liver meridian, and gallbladder meridian. We're going to choose 4 points. And these 4 points are the sun point of the meridians. The first one is small intestine 8, 小海 point. I'm going to show you on my arm. Okay, over here. Now we all have an elbow pointy bone in here. Right, elbow pointy bone in here. Then if you go to the outside bit, there's another one. If you go to the inside bit, there's another one. So I want you to go, or you're pointing in the outside, like this is your palm facing yourself, and the back facing the outside, and the pointy one is like this. All right. So come to inside, your side, not the outside. Okay, your side, this side, because this is facing your, okay, not the outside. Okay, and then go down here, your side. So there's another pointy bone. So 2 pointy bone, and then you put 1 more fingers in here to make what? To make a triangle. So this in this end of the triangle, so make 1 point. Put 2 fingers in here. I'll show you. Put 2 fingers over here, and thumb and what? Middle finger put it on 2 pointy bit, and 1 finger put it on here. Make it into what we call a triangle. So where your index finger is, this is small intestine 8, and press on it, press it around, get the most sensitive one. And you hit that one, it's going to reduce the small intestine. And small intestine is belong to heat, fire. So we reduce that and we reduce the heat. Right. Press to 1 to 2 minutes. Rub 1 to 2 minutes. The next one, heart. Heart, according to Chinese medicine, is fire. We want to reduce the heat, reduce heart meridian, which is Szenan and Szenan point is heart 7 over here. So your little fingers on your palm side, this is your little fingers, come down to here and reach the crease of the wrist, okay, over here. So this is the point, and this point is Szenan point, heart 7, okay, heart 7. Right. Further on, Yang Fu point is GB38. GB38 is in the outside of the ankle bone. And you keep going, like this is the tibia bone. So along the tibia bone, you put your finger up, and you find that along the tibia bone, you go up and then go down a little bit. A bit of depression still on the bone, shoop, down there, and that is the point that before GB38, and this is quite sensitive too, quite sensitive. So go ahead to top 1 or 2 fingers distance and go ahead to do that, and you won't feel depression in here, but you go around and press it and get the next sensitive point, and that is GB38. On the GB38, you do 1 to 2 minutes. That's it. All right. The next one is level 2. What level 2 is, and between your big toes and your second toe, and behind this, on this area, right? Basically, is if this is a big toe, this is second toe, in this area, right? And press it for 1 to 2 minutes. Okay. So small intestine 8, heart 7, GB38, liver 2. Those are the acupressure points that you can search online on Google and to look for some picture to understand how to locate the point, or you can replay this video to figure that out how to locate those points. And those points, small intestine 8, heart 7, GB38, and liver 2 are very good for hot flushes. We're talking about the symptoms. Right, now you know we have hot flushes symptom point, 4 points that you can do. If you're an acupuncturist, those 4 points you can needle it. If you're not an acupuncturist, you can just press it every day, do an acupressure. If you're an acupuncturist, you want to show your patient how to do this point, you can send this video link to your patient, or when you show your patient how to do it, I normally show them one at a time. So if they come 4 times, you show them 4 points, one at a time. If you show them too many points, they forget. They can't pick it up too much for them. Now, the next thing is when you have menopause, hormone imbalance, those spleen 6 and spleen 9, you must add it on. Okay. And you must do it yourself. We play this video, and for all organs imbalance 1, then those 3 points, large intestine 4, pericardium 6, and stomach 36. Those are the 3 points that doesn't matter what the cause of your hot flushes, you need to do all these 3 points. I hope this makes sense, and it's so simple for you. This is the strategy that I use for my patient. I suggest my patient do, and I hope it's going to help you too. Right? Stay awesome. I'll see you tomorrow. Tomorrow we're going to talk about diet, lifestyle change, diet. What sort of diet change that can help and improve your hot flushes symptoms? I hope this has been valuable for you, and if it does, please give you a thumbs up and leave down your comment and let me know what has been helping you recently and what has not been helping you for your hot flasher, and anything that you try that's been useful for your hot flasher. If you're an acupuncturist, share with me what sort of point that you've been using that are very good for hot flasher. Leave your comment down there, and I really want to know, and I appreciate that your share. And then please share this live video on your social media. See you tomorrow. Bye bye.